Hey everybody, this is Dr. Dan Salatko, and this is a segment of Getting Healthy with Dr. Dan. What we're going to try to do with these segments is basically give you some options for health and what you can do for some therapies that you may not know are available. So today what we're going to do is we're going to talk about cold laser. Basically, cold laser is a therapy that's been around for many years, and it's used therapeutically to help several different types of conditions. It can help sprains and strains, it can help carpal tunnel, tendinitis, plantar fasciitis, and one thing that we use it a lot for is degenerative joint disease. So for degenerative joint disease, this is a condition that oftentimes will go to the point where the joint gets so bad, like a knee, you have to have surgery to replace the joint. In some instances, people may be too young to have the joint replaced, or they may just be not a candidate for surgery. So this gives an opportunity or an option in something other than surgery. So I'm just going to kind of show you the machine, kind of walk you through it, and show you what the therapy is about. So the machine over here, basically, it's a pretty simplistic machine, and this is actually the laser itself. I'm just going to turn it on here. And so what it does is it will shine just a light, and the light actually energizes the cell. So if you think of the cell as like an engine, what the light itself does is it energizes it, and research has shown up to 9 times to show or to improve the actual healing capacities of the laser and of the joint. So I'm going to show you on my knee. And so what we basically do is we just start around the joint and we just kind of work our way around the knee joint. And so what this does is it helps things like decreasing waste materials in the joint from wear and tear. It can help to speed up injuries. It also helps to get inflammation and fluid out of the joint. So we see that patients who do use this type of therapy have great benefits. Just a couple examples here. I have a patient who is in his 70s, and he was somebody who was not a candidate for degenerative or for knee replacement. And so we did therapy on him, and now he's back to reffing high school basketball games and also is playing softball this summer. So everyone's a little bit different, but what we find is that in about 80% of the individuals that we do therapies on, we get some type of relief, if not complete relief, of their knee pain. So some of the things that help or are benefits of the cold laser, it's very safe. It's a non-toxic type treatment, non-invasive, so we're not looking at any type of surgery here. Very cost effective, and it gives you an alternative to things like non-steroidal anti-inflammatory disease. So the therapy itself, you may feel just a little bit of warmth as we work the wand around the knee, but for the most part, you don't really feel too much. The initial treatments sometimes leave the knee a little bit more stiff, but after a couple of treatments, the knee pain and the inflammation does start to improve. And typical treatment plans are anywhere between 6 to 8 weeks of treatment, and these treatments are done several times per week. All right, so that's the cold laser treatment, and if you have any further questions, you can get a hold of me at Getting Healthy with Dr. Dan on our Facebook page, or also contact our office for more information on how you can utilize this type of treatment for your care. All right, guys, have a great day and stay healthy.